For our final morning session before taking a brief intermission, we have John McMahon. John is the Director of Client Experience and a Senior Product Specialist for the Wellbeing Index, the comprehensive online self-assessment tool invented by Mayo Clinic. Since joining the Wellbeing Index team in 2015, John has helped hundreds of leading healthcare organizations successfully launch the Wellbeing Index to hundreds of thousands of healthcare professionals. He has worked directly with administrators at leading institutions, academic medical centers, independent hospitals, national health systems, associations, and more to advise on best practices regarding well-being assessment and support. His expertise in healthcare employee well-being and wellness programming implementation has provided leadership teams from around the world with the data, resources, and support needed to go beyond burnout and foster a workplace culture of wellness. Today, John will be presenting on how to build a foundation of trust within your organization. Please join me in welcoming John McMahon.
Thank you for that great introduction, and thank you all for being with us at the Champions of Wellness Summit. I'm so happy to be here to be able to share my presentation with you today. My presentation today is how to build a foundation of trust within your organization. So as we get going with this, a little bit about myself. My name is John McMahon. I'm the Director of Client Experience with the Wellbeing Index. I've worked in my current capacity leading our client success efforts since 2019, and I have directly helped hundreds of clients implement the Wellbeing Index to improve the well-being of their providers. For those of you who may not be familiar, the Wellbeing Index is an assessment invented by the Mayo Clinic to help healthcare leaders measure and support the mental health of their workforce. For over 10 years, our team of healthcare well-being consultants, researchers, and thought leaders have worked directly with institutional administrators to help guide their efforts to build a culture of wellness and promote well-being. Like many of my colleagues, I have friends and family, including my wife, working in the healthcare industry and have seen firsthand the detrimental effects of challenges like burnout, inadequate staffing, and moral injury. We have made it our mission to help organizations improve their workplace through creating a culture of wellness. I've also worked directly with healthcare leaders as they try to grapple with these issues. Today, I'll be drawing on the insights gathered from working with these organizations and leaders in launching the assessment and support tool to hundreds of thousands of medical professionals. From this wealth of experience, this presentation will outline the successful strategies and best practices to build one of the most critical aspects to a successful wellness program: trust. We're going to focus today on successful strategies that leaders can use to create and maintain a foundation of trust within a healthcare organization. But this can also be applied to any organization, not just healthcare. By examining our experience working with hundreds of leading healthcare institutions to improve medical professional well-being, we will share why trust is a necessity in any wellness program, the factors that usually create distrust, and how clinical leaders and wellness administrators can gain the confidence of their staff to effectively support their well-being. Before we get into the details, we need to know what trust looks like, specifically in a healthcare setting. As Michael C. Bush, CEO of Great Place to Work, said, "The root of the tree is trust. It's the foundation of a successful, thriving workplace where providers and patients alike can flourish." It's difficult to trust when you feel a lack of respect. This can manifest in numerous ways, from little things like using colleagues' names and appropriate titles, to the larger challenges being addressed by many organizations' diversity, equity, and inclusion efforts. However, you address these challenges, respect must be present in order to build that trust. As our work with our clients and the understanding of well-being within the workplace has changed, so have our approaches to creating a culture of wellness. One of the most prominent changes I have experienced is the move from a focus on individual professions, for example, the physician wellness team or the nurse wellness team, to a more holistic approach focusing on all professions within departments. Healthcare teams rely on all members working together to provide the best outcomes for their patients and each other. If one part of the team is suffering, it affects everyone. Healthcare is tough, with the joys of saving a life or seeing a patient who is struggling doing better, balanced by the sorrows of consoling families who've lost a loved one or working with a patient who is particularly angry or upset. It takes the whole team working together and supporting each other to be successful. You need teams that trust and support each other rather than those who are divided or pointing fingers. In fact, a 2021 study by Dr. Aaron Sullivan and colleagues found that while the primary driver of addressing administrative waste and efficiency was initially chosen by many teams as the nexus of a quality improvement project, the teams most successful in reducing burnout were those that coupled the efficiency driver with the strengthening team driver. Building that support within teams is as important as the more obvious challenges like too much administrative work or overtime. And trust is a critical component of creating those effective teams. As former US Secretary of Labor Robert Reich developed, he has a pronoun test, and it's a quick barometer of trust and performance in teams. Those who use we and us rather than they and them when referring to their organization and team had higher levels of trust and better overall performance. So it's a really simple way that you can think about or look at what's the trust level with our team? How are we doing? Listen for those we and us pronouns. And let's make one thing very clear. Leadership does not mean micromanagement. Study after study shows that great leaders are those that act with integrity, treat their teams with respect, and trust their teams to perform with excellence. Providing your professionals with control and flexibility over their work while providing the guide rails to ensure consistency and adherence to organizational goals and values is a key. A study published by Dr. Donald Freeborn in 2001 showed that perceived control over the practice environment was also the single most important predictor of physician burnout. And a 2009 study by Dr. Tate Shanafelt and colleagues found that the physicians who spent at least 20% of their time on work they found the most personally meaningful had burnout rates half that of those who spent less than 20% of their time in those areas most meaningful to them. So trusting your providers to perform their duties and giving them the ability to focus on the areas they find most meaningful can help reduce burnout, increase satisfaction, and have a positive impact on patient outcomes. So now that we know what we're aiming for, I want to look at some of the common challenges found in many healthcare settings. We have two focuses here. First is something that Dr. Shanafelt has been speaking about more and more recently with his concept of physician well-being 2.0, the systemic challenges leading to burnout and distress. It's time to move beyond only trying to address individual well-being and begin looking at organizational challenges that contribute to a lack of trust, increase in burnout, and lead to a whole host of adverse outcomes. The second is on the word distrust. Mistrust and distrust are often used interchangeably, but we're specifically using distrust because it can express a lack of trust stemming from a specific experience or certain knowledge. In other words, lack of trust in healthcare organizations is often caused by specific actions or inactions, whether the intent is to sow distrust or not. So what are some common causes of distrust? As Dr. Shanafelt and Dr. Stephen Swenson wrote in their book, Mayo Clinic Strategies to Reduce Burnout, excessive metrics are a manifestation of lack of trust. Think of all the various measurements present in healthcare today, from patient satisfaction scores to minutes per visit to the speed of clearing inbox messages. Some are necessary, but many serve no purpose other than micromanaging your providers. Many of our clients ask their providers, what are the two things that make your work most difficult? And one of the most common responses is feeling overloaded by the administrative duties and required activities tied to metrics that take time away from directly working with patients, which consequently is also one of the top things that most providers say when asked what are one of the things that makes your work most meaningful. It's that time with patients. So feeling that every part of your job is dictated and measured, and that you have no agency to use your training and experience to address patient needs has been shown in multiple studies as a primary driver of burnout and distress. Leadership and management expert Brian Tracy has often said that trust is based on integrity. And one of the leading causes of distrust, as well as moral injury, distress, and other adverse outcomes, occurs when the values of an organization are not manifested in the policies, procedures, or actions of those within the group. So this can happen at any level, from leadership failing to exemplify core values to decisions made regarding the care of a patient that may negatively impact relationships between those on the care team. One of the most common examples of this that we see is feeling like the organization is prioritizing numbers over people. So whether it's statements like, I'd like leadership to be more concerned with our patients and providers than the amount of money coming in, or don't they realize we're people and are at a breaking point? We can't keep doing more with less. With well-being index, we hear the actions and the responses of people that show that the organization don't always have their actions match up with their stated values. And it tarnishes perceptions of integrity and feelings of trust. And there are many changes facing healthcare and providers and organizations. You have staffing challenges. You have challenges now that are about ensuring stocks of basic supplies. But it's important that leadership recognizes any shortcomings and addresses them, even if it's just acknowledging the issue and providing an example of how they are attempting to address it. Failure to do this causes professionals to feel unsupported by the organization and leads to resentment and distrust. So this also affects individuals at a team level. A survey by the Learning Nurse Resource Network showed that poor teamwork, including poor communication, tension and conflict, no cooperation, and unwillingness to help, was the top driver of stress among nurses. So now we've identified at what trust and distrust look like in an organization. How do we create that trusting environment that is such a key to creating the culture of wellness? It starts with transparency and communication. Transparent communication is one of the most effective ways to build trust within teams and organizations. It encourages honesty and openness and helps teams feel comfortable addressing any challenges that arise right away, rather than letting them sit unattended until they boil over. Clear communication is critical. Designing policies and procedures to encourage open communication is a start. You'll likely need to utilize multiple avenues to ensure that communication is being heard. But one of the most effective means we've seen is direct face-to-face communications. Oh, and I'd also be remiss if I didn't point out, communication from leadership to your teams is important, but perhaps even more so is ensuring open lines of communication from your providers back to leadership. As Dr. Shanafelt and colleagues published a look at what healthcare professionals were seeking from their organizations during the COVID-19 pandemic, one of their key takeaways was "hear me," or the desire for organizations to listen to and act on the expert perspective and frontline experience of their providers. This includes addressing their concerns to the extent that organizations and leaders are able. Even if you can't address something right away, it's still important to acknowledge it and maybe explain why it can't be addressed right that minute, or maybe in the way that somebody's looking for. And transparency doesn't work without honesty and empathy. Honesty is implicit in the idea of transparent communication. But as the actor Mae West said, it's not what you say, but how you say it. Empathy is a key trait for any healthcare professional. You have to be able to connect with your patients and their families, put yourself in their shoes, and fully understand their needs and the proper way to care for them. This is no less true when it comes to relationships with your colleagues or the organization's relationship with their providers. Organizations need to provide continued training on empathy and encourage respectful, honest communication between professionals. Expectations, how they are tracked, and any consequences of not meeting them should be clearly stated and understood by all. Processes need to be in place to encourage and facilitate open, honest communication. This takes work and is not necessarily easy to implement. But once you develop a culture where colleagues can openly and honestly share challenges or disagreements in a respectful and empathetic manner, you'll have teams that trust each other and the organization. Providers often know what they need or understand how to solve many of their day-to-day challenges. So top-down decisions and solutions, while well-intentioned, are often met with responses of, "That's nice, but it doesn't solve anything," from the professionals who are the intended beneficiaries. Empowering teams to address the challenges facing them and providing clear lines of communication to leadership who can help with issues that are beyond their scope to fix goes a long way in building trust, along with the benefits of increased efficiency and professional satisfaction. As Dr. Lottie Derby, co-creator of the Wellbeing Index, likes to say, "Nothing about me without me." When you put it all together to have an open two-way communication, consistency of messaging, matching up with action, and ensuring that your teams are included in the solutions, you're well on your way to building trust across the organization. So here are some strategies to promote transparent communication in your organization. The first key to achieving transparency within your organization is ensuring the leadership structure, roles, and responsibilities are clearly defined and understood by all. This goes for every layer in your organization and will vary to fit specifics within your groups. It's not practical for a large multi-hospital health system to have every individual provider know the roles and responsibilities for every individual in the organization. However, they do need to know who on their team is leading their quality improvement or wellness efforts, and how any ideas should be communicated. It's very difficult to address a challenge or share a great idea when you don't know who to turn to or what the process is for doing so. Likewise, those leaders need to know who is in charge of these efforts at the next level of the organization, and so on up to the highest levels of leadership, so that any challenges or issues that come up can be addressed by the appropriate teams. If you've done any study or work in personal and professional development, you've probably heard some form of "you are what you emphasize" or "you get what you focus on." Transparency is no different. If you want to achieve transparency within your organization, you need to hold it as a guiding principle when reviewing your policies and procedures, and you need to help train every person in your organization on empathy to ensure that your efforts are effective and moving your organization in the right direction. Building transparency within an organization requires looking at all facets of how you operate on a day-to-day basis. We all know that change is difficult, so any opportunity to tweak or update an existing policy or procedure to increase transparency is a great way to start. You may find that it's necessary to create new policies or ways of doing things, and that's okay too. The key, once again here, is to include your providers from the start and look at what your departments have the ability to change themselves to create increased transparency, honesty, and empathy among their teams. What's great for organizational leaders is that you can have each team or department start addressing their needs individually while adjusting the overall flow within the organization to increase transparency and communication as that work is being done. Often, the challenges that a single team cannot address will be similar to what other teams are also experiencing, and those can then be addressed for all further up the ladder. This work all takes commitment and an investment from across the organization, but the results can be transformative. In research published by Great Place to Work in 2016, healthcare organizations with the highest levels of trust reported almost 50% higher job growth compared to those with the lowest levels of trust, as well as a turnover rate that was about half the rate of the industry average. So there's a case study on our site looking at the wellness efforts from one of our clients, a regional health group. Their response to COVID-19 pandemic exemplifies the positive impact that open, transparent communication can have on healthcare workforce. At the outset of the pandemic, the CMO and CWO of this organization, its Chief Medical Officer and Chief Wellness Officer, they began holding weekly town hall meetings open to all employees within their organization. At these meetings, they would give updates on patient load, positivity rates, PPE levels, and the latest information regarding what they knew about the virus. You have to remember, this is at a time when people were unsure exactly how this was being spread and what the best treatments were. Do I have to leave my package out in my garage for a week? All of those things. So they also then answered questions from those attending the meetings. They answered honestly, and if they didn't have or couldn't answer, they would either find the answer or explain why they could not answer. And while those responses may not always have been the most satisfying, they were absolutely appreciated by those in attendance. The response to these meetings was immediate and overwhelmingly positive. Professionals expressed their gratitude that these busy individuals were taking time to hold these conversations each week, and they shared how they felt the organization truly cared about them by hearing their questions and concerns. And while they don't hold these meetings on a weekly basis any longer, they are planning to continue them either on a monthly or quarterly basis. And the organization is committed to improving the well-being of their providers through creating a culture of wellness. They actually recently received national recognition for these efforts, and transparency plays a key role in their success. Transparency is important, but no change can occur without action. And you can read a million books, attend hundreds of conferences like this one, take notes, do all of those things, but without action, it's all just so many words on paper. Nothing will change without action to start turning the wheels. It takes a lot of work to get started. There's a lot of inertia to overcome. Anytime change is necessary. But the great thing is that once you take action and start moving, the momentum builds and more people jump on board. There's a great TED Talk by Derek Sievers. Many of you are probably familiar with it, but it talks about how to start a movement. It's a great framework anytime you need to make a change. It's a good thing to think about. Basically what it is, there's a guy on a hill dancing at a concert. It's a grass hill, bunch of people just sitting there, and it's this one guy by himself dancing, having a good time. And slowly another person comes over, starts dancing with him, engages with them, and they're both dancing. And then a couple more people come over, and then a couple more people come over. And by the end of this video, you've got the entire hillside dancing, right? So it's all about how to start a movement. It only takes 3 minutes to watch it. These slides will be shared. There's a link in the slide. I highly, highly, highly recommend you take a look at it anytime you're looking for some motivation when it comes to creating change, because that first part can be a really lonely experience. And it's great to remember that people will keep coming if you start taking that action and get those wheels turning. We also have a saying here at the Wellbeing Index that acts as a guidepost for us when we're considering adding a new report or feature. And that is it interesting or is it actionable? Interesting data is great. There are people whose entire careers are based around looking at data and finding all kinds of interesting facts. But when it comes to the work of improving well-being or creating trust within an organization, interesting doesn't cut it. You need data that is actionable. The same goes for any of the work you are doing to create change. You must have an end goal in mind, whether that's increasing trust, improving well-being, whatever it might be, and then take steps that are actively getting you closer to those goals. Focus groups, wellness committees, assessments is all part of what it takes to do this work. But if you aren't getting actionable insights from them, then it's just a waste of time and effort. I'm returning to Dr. Derby's quote for this one. It takes a little bit, again, of thinking about, nothing about me without me, right? Taking action without the inclusion and partnership of your providers and employees is a self-defeating proposition. In addition to the benefits of an increased sense of agency and building trust, starting with small changes at the care team or department level is much, much easier than trying to make wholesale changes in the organization. You're also able to enact change that have a direct impact on the day-to-day lives of your providers and show a quicker result than larger changes that may take more time to implement. It's also important to recognize that change is often a process of trial and error. It's much better to try something with a smaller pilot group first to verify you're getting the results you want, adjust if you're not, and then send that out to the rest of the group or the rest of the organization, rather than trying to implement some changes at the entire organization level, only to find out, oh, this isn't quite working right, or this needs to be tweaked over here, or whatever it might be. So action for action's sake isn't helpful though, right? Taking the right actions will help not only improve your organization, but also build the trust among your teams that you're moving in the right direction and you're doing the right things. The first step is figuring out where you are within your organization. The beauty of everything we're talking about today is that you don't have to be an executive at the highest level of your organization to start making change. However, you do need to understand where you fit and who you may need to get buy-in from in order to effectively create that change. That could be colleagues, departmental leadership, or the chief medical officer at your hospital. We use a mental model here of an upside down triangle to help visualize this. The top of the triangle is the widest part and represents the individual care teams or departments, depending on the structure of your organization. As you move closer to the point of the triangle at the bottom, you're looking at higher levels of leadership within the organization. So maybe you go from a care team in the pediatrics at a pediatrics department within your hospital, to the hospital leadership team, to a regional leadership team, and finally to the organizational leadership team. Knowing where you sit in that structure is critical in taking effective action. As we discussed before, having a clear understanding of the organizational structure and a flow of communication is a key to transparency. So these actions support each other. The next step is taking positive action is to build trust and improve well-being, or to build trust and improve well-being is to focus on what you can control. So if you are just starting out on this journey and you're a member of a care team within the pediatrics department at a single hospital that's part of a multi-hospital system, trying to focus on change that affects the entire system is going to be a daunting task. However, focusing on how you communicate with your colleagues, how handoffs between shifts are conducted, or how scheduling within your department works are all areas that you can influence and opportunities for you to create a sense of trust and camaraderie within your department. As you build that culture within your department, you'll find challenges that are beyond your control or ability to address. In those cases, your department lead, or maybe even yourself as the leader of your wellness group, will need to connect with departmental or hospital leadership to bring up these issues and address them there. If you're further up the leadership structure, you can encourage this type of thinking and give your teams agency to create change and to work to identify the areas that they have control over and challenges where you are best suited to address. And perhaps solicit ideas from your departmental wellness teams to see if there are commonalities and where they are looking for your help. The third thing you can do is to be an example for those around you. We've all heard the quote, "Be the change you want to see in the world." And that is absolutely true when it comes to building trust within your organization. Displaying honesty, integrity, and empathy with your colleagues. Be the dancer happily doing their thing at the concert. Get one or two others to follow suit, and eventually you'll have a whole crowd on board, working together in a trusting environment that can then set the example for the rest of the organization. A great example of someone understanding where they are in their organization and taking action to improve well-being is Lori Ortman, the chief nurse anesthetist at Capitol Health Medical Center in New Jersey. Lori looked at her colleagues and saw the signs of burnout and distress. She knew something had to be done and determined that Headspace was a quick solution that could be making a big impact. She also wanted to measure the effect that Headspace had on the well-being of her clinicians. And so she chose to work with the well-being index to measure that success. Using the results from this validated measurement tool, she then went to her leadership team at Envision Physician Services and made the case for utilizing the well-being index across the organization. Based on the results of her study on the effectiveness of Headspace and her experience using the well-being index with this group, she was able to get buy-in from her leadership team, and they now offer the well-being index to over 16,000 clinicians throughout their organization. This was not an easy process, but Lori was driven by the desire to show her fellow clinicians that someone cares about you on a personal level, even within an organization as large as Envision. In the end, her work and perseverance, coupled with additional wellness champions she connected with along the way, have had a massive impact on her organization. Her story shows that even one person within an organization with enough passion and perseverance can enact lasting change. I'd be remiss if I didn't mention that Champions of Wellness actually published an interview with Lori in their first issue of the Champions of Wellness magazine. And I highly encourage you to check that out and read it. It's a great article. It really goes into what she did and how she did it, and kind of what some of the impacts were. Really good read. Okay, so as we've seen, building trust within your organization in order to create a culture of wellness takes buy-in and sustained commitment from all levels. We've also shown that you can start this process no matter where you are within your organization. So let's look now at how you go about building the confidence and partnerships you need to create and sustain that commitment. The key is using a measurable, evidence-based, and data-driven approach. This gives you a solid foundation to work from and a clear view as to whether or not your efforts are having the desired impact. We're adapting a marketing strategy called growth-driven design as our model for how you can build staff and stakeholder confidence using a measurable, evidence-based, and data-driven approach. Prior to my work with the Wellbeing Index, I worked for a web design and marketing firm that used the growth-driven design framework. The idea is that you can measure the results of your website or digital marketing, or in this case, your efforts to make change and increase trust and improve well-being, and then make incremental changes to improve performance. We use growth-driven design to make improvements, showed our clients that the investments that they were making in their websites and marketing were having a positive impact on their bottom line, that elusive return on investment or ROI that everyone's looking for. And we found ourselves applying these same approaches to many facets of our business and even our personal lives. Often when a challenge would crop up in the office, we'd say, just GDD it. So this framework is ideal for creating change and building trust in healthcare, because much like everything else we've just talked about, it can be implemented regardless of where you sit in the organizational structure, and the results will help you build buy-in from your colleagues and leadership. So a core tenet of this approach is to choose one thing at a time to improve or work on. If your goal is to build a foundation of trust within your organization, you may have a number of different strategies to try, but it's imperative that you focus on one at a time, or you won't know where any change, positive or negative, is coming from. Change doesn't happen overnight, and patience is important when taking this approach. But it's worth it when you can clearly show that we did intervention A and trust increased by 5%, or we did intervention B and our well-being improved by 6%. It's possible to test multiple strategies at once, but you want to use different groups and focus on one strategy for each group to see if one or the other shows a better improvement. Another key of growth-driven design is that we weren't just telling clients their marketing efforts were working, or even going by murky stats like number of likes or clicks or views. We were actually able to show the number of people who purchased an item or signed up for an offer and how that changed based on slight updates or improvements that we'd make. This translated directly to how much money they were making from their investment in our services. Similarly, using this approach in healthcare will allow you to show the results of your efforts in measurable ways that directly impact the outcomes of your team. The third part of the growth-driven design mentality that makes it suitable for healthcare is that successes are designed to be repeatable. You can take what you've learned in one part of your organization and translate it into success in another department or within another group. It's also flexible enough to adapt to the unique needs of your providers and their experiences. So what does this look like when we think about growth-driven design in healthcare? There are 4 considerations to take into account. The first is that a validated means of measurement is necessary. You won't know where to improve or be able to show the outcomes of your efforts unless you measure them. And using a validated measurement tool increases the credibility of and confidence in those results. Next, you'll want evidence-based support for whatever interventions you may be trying. More and more research is being conducted on the effectiveness of various interventions, so reinventing the wheel isn't a requirement. What's great with the growth-driven design approach is that you can take an evidence-based approach and tweak it to fit your organization, then measure if those tweaks are having an impact. The third consideration is using the data garnered from your measurement to determine what incremental adjustments to make in order to reach your goals of building trust and creating a culture of wellness. And lastly, this is repeatable. It's an ongoing cycle of continuing improvement. Whether trying something new or making what's already there better, you have a framework and process to work from. Let's take a closer look at what this might look like in your work as a champion of wellness. Validated measurement provides a number of benefits. I'm going to use the well-being index for these examples because it's what I know best, but this applies to any measurement tool that you may be considering. You'll need to take a baseline measurement of your organization to know where you're starting from and possibly what areas to focus on first. A tool like the Wellbeing Index also provides national benchmarks for context. It's a great way to improve your understanding of where you're starting and set the stage for the work to come. A validated tool has been researched and reviewed, and you know that the results can be trusted. It's easy enough to come up with questions and ask them via a Google form, but having a validated tool lets you know that the questions will give you accurate results. It also lends credibility to your results when you're presenting them to leadership and can be tied directly to measurable outcomes, burnout risk, turnover rates, etc. Choosing a tool that has been used by many people over the years demonstrates that they have found it effective, and it provides a large data set for benchmarking your results. It also means it's a tool that others have experience with, and therefore increases the chance that the results that you have or that you create with this will be understood by a wider audience. Communicating your results is a critical part of the process, so having the same frame of reference for everyone involved will make it very much easier. And the end goal of building trust or creating a culture of wellness within an organization is to provide a better, healthier work environment for your team. Preferably, the tool that you choose to measure the results of your efforts will reinforce those goals through providing meaningful individual results to your participants, and possibly even include resources to help them improve either individually or as a team. So once you have your baseline data and ideas of where the opportunities are for improvement, you need to decide on an intervention or change to start moving towards your goal. So let's say you've used the Wellbeing Index to measure the well-being of your organization, and you use the process improvement feature to ask the top 2 areas of difficulty facing your participants. Analyzing the results shows that one area a lot of people identified is poor communication between the organization and your teams. So now that you know that this has a massive impact on trust and well-being, and you determine that this is the first piece you want to address. So where do you start? The best place is to look for existing strategies that have been proven to work. You can search the literature for studies based on your topic, proven communications, or if you're using the Wellbeing Index, you'll have access to the WBI community where you can connect with other administrators from similar organizations to see if anyone else has attacked a similar problem and found a particular intervention helpful. We also have a list of studies specifically using the Wellbeing Index to look at the effectiveness of wellness programs and initiatives from organizations like the University of Pennsylvania, the Ohio State University, and Weill Cornell Medicine. Once you've found an intervention that you want to implement, you'll be able to pilot it and measure the results using your validated tool, in our case, the Wellbeing Index. You can then use the growth-driven design approach we outlined to make any tweaks, changes, or updates to the program that you'll need to make it effective across your organization. The key here is to focus on implementing solutions to the actual problems driving distrust, burnout, or low well-being. All too often, we hear feedback that wellness initiatives driven from a top-down approach are appreciated, but aren't actually addressing the issues that drive adverse outcomes. In the worst-case scenarios, individuals feel like their organization is just checking a box and doesn't really care about them. So a poorly designed or thought out initiative can actually have a detrimental effect when it comes to trust or well-being. The best way to prevent this is to engage your teams and empower them to find solutions whenever possible. In this case, you use direct feedback from the Wellbeing Index to identify problems with the communication between leadership and the individuals within your organization. You've determined that the best way to implement this or to change this is to begin a monthly town hall discussion with each of your departments. In an effort to increase trust and engagement, your announcements include reminders that these are direct results of the feedback received from the recent Wellbeing Index assessment, and it includes both an agenda of the topics of discussion as well as an open Q&A session with all questions welcome. Your first few months of the town hall meetings have occurred now, and while there may have been some rough edges to be smoothed out, overall they were well attended, and initial feedback is that they were appreciated. So your next step is to reassess using the Wellbeing Index to determine the impact that these have had on your teams. You get the results of the reassessment, and you need to report back to both leadership and your teams. You see that the distress scores have improved and that the number of individuals at high risk of burnout, fatigue, and other adverse outcomes there has decreased by 5%. This translates to a decrease in the likelihood that these individuals will leave the organization in the next year from a 3 times higher than average to an average or lower likelihood. Based on these numbers, you're able to report back to leadership a monetary savings in recruitment and replacement costs as a direct result of this initiative. Remember, a key part of the growth-driven design mindset is to show, don't tell, to provide a tangible result, proving the value of your efforts. You're also going to ask your teams what they like most and least about the town hall and what they would change. Overall, the reaction mirrors what you heard from people at or after the events. But you see a large number of requests to hold a larger town hall for the whole hospital and decide to hold a biannual meeting where the organization leadership can give updates and be available for Q&A. By continuing this line of questioning around the town hall events and these reassessments, you're showing your participants they are invested in their well-being and are committed to ongoing improvement efforts. As you continue developing trust within your organization and working on improving the well-being of your teams, you can use this method to continue to look for areas of improvement and the changes and the changing needs of your staff. By continuing to communicate and take their feedback into consideration, you reinforce the trust between your teams and the organization. Once that trust is established, you can then continue to evolve into an organization that empowers their staff to solve problems and address challenges at the department level whenever possible, and establish clear lines of communication to bring any larger issues to the attention of leadership at the appropriate level. This engages your teams and makes them feel trusted, valued, and respected. And it frees up your leadership to focus only on the challenges that require their attention. Repeating this process will ingrain it into the everyday operation of your teams and make it second nature. So to review, the work of building trust and a culture of wellness within an organization is not easy. It takes many people to be successful. No matter where you are in your organization structure, you have the ability to use the tools of transparency, action, and a data-driven approach to build trust and drive change in your organization. Don't be afraid to be the lone person dancing on the hill. Eventually, others will join in, and before you know it, you'll have a movement. One final thought, we've established that trust is a key factor in creating a culture of wellness and improving the overall health of your organization. Once that trust is established, you can continue to evolve into an organization that empowers their staff to solve problems and address challenges at the department level whenever possible, and establish those clear lines of communication to bring any larger issues to the attention of leadership at the appropriate level. When you create a culture of wellness, you build a happier, healthier, and more successful organization for everyone. Thank you again for attending the Champions of Wellness Summit, for listening to my presentation. You have my contact info here on the screen. If you have questions, if you have comments, if you have any kind of feedback, we are always open ears at the Wellbeing Index. Love to hear it. Love to have those conversations with you. So feel free to get in touch and enjoy the rest of the conference.